Thank you so much, Amy. And just also to answer, if I can put my 2 cents in, one of the things that we try to do in our community is to reach out to people who are in marketing and PR and ask them to volunteer for us to get our message out for us. So that may help if you just kind of put it out to your community. I'm so excited to introduce the next panel that's going to speak to you, because for me, they're kind of like my 3 musketeers. I have had to personally call on each of them to help me through either rough spots or understanding, and they are always there. So next we're going to hear from Drusy Borowitz, Mary Dwight, and Bruce Marshall. Drusy is the Senior Vice President of Community Partnerships and oversees the Foundation's efforts to bring the perspectives of a wide range of people affected by cystic fibrosis to all Foundation activities, and to provide ways for people living with CF to interact with each other in new and meaningful ways. Mary Dwight, Senior Vice President of Policy and Advocacy, joined the Foundation in 2006. She directs public policy efforts to advance research and drug development and improve access to high-quality cystic fibrosis care, integrating the organization's public policy and advocacy work. Bruce Marshall, Senior Vice President of Clinical Affairs, joined us in 2002. And he directs the clinical-related activities of the Foundation, including the Care Center Network, quality improvement, clinical practice guidelines, patient registry, and educational resources. It's my pleasure to give you my 3 musketeers. Thank you.
Thank you, Bonnie. It is great to be here this morning, and to everyone online, especially you folks in Pacific and Mountain time zones, thanks for waking up early and enjoying coffee with the rest of us here. So we have a connected story. We want to talk about how things that the Foundation has been working on in this past year are truly powered by all of you, powered by the community. And I'm going to start by talking about community voice. It was my great pleasure last year at VLC to launch Community Voice. This is a group that began as a courageous innovation of bringing the voice of individuals with CF and their families into Foundation activities. It began as the Adult and Family Advisors, and last year at VLC, we announced the rebranding to Community Voice. This was a name that was created by the community, and I want to tell you what we've done in the past year. So this is a group that now is over 800 people, and they are about 40% adults with CF, about half parents of people with CF, and the remainder are a mixed bag of spouses, grandparents, other family members, etc. I will say the group is about 70% female, so all you guys out there, we want to hear your voice as well. You too. Members come from all over the United States, which is fantastic. And the membership sort of mirrors the population of various states. So I would like to take a moment. I know many of the people in this room, some of you online, are members of Community Voice. If you're online, you can stay sitting down and drinking your coffee. But if you're in the room, could you please stand up? We really appreciate everything you've done. So let me tell you a little bit about Community Voice. In this past year, since last VLC, there have been about 70 opportunities for people to participate in Foundation activities or contribute their perspective. We mostly contact people by email. We sent out a lot of emails. And often we have surveys attached to what we do. However, these surveys are short. They take about 5 minutes apiece. And we don't expect that people are going to answer every single thing. We understand people's lives are busy, and so people participate in what they are interested in when they have the time. At the end of the year, we did another survey asking people what their experience had been. And the majority of people felt that this had been a really good experience for them. And I will give you a few of their quotes in a minute. About a quarter of people said, it's not enough, we want to do more and have deeper opportunities. And so in addition to surveys, people can participate in focus groups, or if they have even more time to give, perhaps join committees. Here are some of the things that members have said about Community Voice, the things that they appreciate about it. They appreciate the diversity of the opportunities to participate, that they know that their opinions and their experiences are making a difference at the foundation, and that their voice matters. In addition, the opportunity to participate when they want to in a way that's easy has been a real plus. So again, everyone has a busy life. You all know you are the people who take time out of your lives to help, but there are some people who perhaps have less time to give, but nonetheless still could be a part of this larger community. And Community Voice is one way for them to be able to do that. So I want to tell you a little bit about some of the topics that people in the community helped us with during this past year, and I'm going to go through each one of these. So informing CF care and research is one of the major ways that we touch on the community to help inform what we do at the foundation. This year, members of the community helped us inform key research priorities, helped us to work with the Partnerships for Sustaining Daily Care on strategies to improve communication with care teams. They've worked on clinical care guidelines, also have helped help us at the foundation to understand the needs of caregivers, which are so important. They've helped us with some difficult topics, like giving us a sense of what we might need to do to help in the space of palliative care or discussing other types of taboo topics. I want to tell you a little bit about Research Voice because contributing to care and research is incredibly important. So Research Voice is a subset of Community Voice. These are 100 of our over 800 members who have, if you could go back one slide, please, who have specifically said that they are interested in research and are willing to do a little bit more training to be able to help us in these endeavors. And the types of things that they contribute to are behavioral research through the Success with Therapies Research Consortium, helping us with clinical trials and drug development, which I'm going to tell you a little bit more about on the next slide, and also helping with registry research. I remember at the very beginning of the quality improvement efforts that the foundation did that one key person said, whose information is this anyway? It's your information. You're the ones who contribute to the registry. And so the opportunity to ask questions of that registry has been a wonderful part of what's happened in this past year. Here are some ways that the community has been involved throughout the study process. So research studies or clinical drug development studies begin with designing the protocol. What are the elements? What should be a part of that? So we have two different ways that people can help. I'm sorry, this slide doesn't have one of them, which just launched a couple of weeks ago, and that's our CF Insight services. This is a group of deeply trained individuals who can help work with pharmaceutical companies early on in the process before a protocol has gelled to give that perspective of the community. And I'm very excited that this is starting to launch now. Members are also part of the Protocol Review Committee. This is a committee of the Therapeutics Development Network so that when a protocol is almost ready to be launched, eyes of people who are actually going to have to do the protocol are on it to say, this is something that's doable. This might be done in a slightly better way to make it a better experience for people in the community while still sticking with the essence of the protocol. I have a little dotted line in here because members of the community have helped shape how we recruit individuals into research studies by helping with the Trailblazer campaign that you all have seen, and last year helping with designing this incredible clinical trials finder. Before a study begins, there's always an ethics review, and the group in the United States that does that are called institutional review boards. So as a way to speed up that drug development process, the Therapeutics Development Network has decided to have a centralized IRB, Institutional Review Board. And those boards always have community members on them, and we've placed some individuals from Research Voice on the Schulman IRB. When a study begins and people have been recruited, you may not be aware, but in a research study, the investigator, the person who's responsible to run the study, and that person's team, as well as the people who are participating in the study, are what are called blinded. They don't know if they are receiving active drug or a placebo, but there is always a group of individuals unconnected to the study who are not blinded and who are looking at that study in real time to assure safety. That's the Data Safety Monitoring Board, another one of the unique things that the foundation has supported, and we've placed members of Research Voice on data safety monitoring committees that are a part of that board, looking at every single blinded research study that goes on. When a study closes, data is analyzed, and then we want to educate people about the results and disseminate that data. And we have individuals from Community Voice, from Research Voice, who've helped the research section of CFF.org to make that information understandable. And then in addition, we have a special group of people looking at registry research and making that accessible to the community. Community Voice members helped in other ways. They helped to create the CF Foundation Cares events. You heard a little bit about these. These are social events that are there for caregivers. People you all are there in this journey, and it's care for the caregiver. Purely social events just to allow members of the community to connect. So if you were a part of a CFF Cares event, which was a pilot program last year, or if you've been a part of the now expansion to these events at every center, or if you were at the breakout session yesterday, will you just stand for a minute? We'd like to recognize you in this also innovative way of connecting our community. Members of Community Voice help to design and promote CF Peer Connect, our peer mentoring program, and to design and facilitate and participate in our virtual events. And what we heard very clearly from all of you over the course of this year is that those events should be extended to family members, and they've helped us with that expansion this year. So I'm going to tell you just a little bit about each one of those things. So CF Peer Connect, as you, I hope, have heard by now, is a peer-to-peer mentoring program that has been available to individuals age 16 and over to connect with someone who has been through the same kinds of life transition that person has been through and can help them along the way. You can see this list of the most commonly asked questions and a few others as well. But what I do want to let you know is that this is expanding to family members in 2018. Not quite ready for an announcement here at VLC, but over the next few months, this will be expanded to parents and to spouses as well as we begin the even larger expansion over time. Our virtual events have continued on. We held one in 2016, 3 in 2017, and we have 6 planned for 2018, as you can see here. We've expanded these to include adult family members. We held our first CF Minicon that included family members in February about self-care and relationships, and it was a wonderful mix, about half adults with CF, and half family members. We have other events that are going to include families this year. Our first CF Family Con is June 3rd, and registration will open about a month ahead of time. Go to cff.org. And our CF Transplant Mini-Con last year was just for adults in the transplant journey, but this year will include adult family members as well. So moving on, you heard a lot about our focus on transplantation. Members of Community Voice have participated in really as an advisory group for the Advanced Lung Disease Guidelines Committee, have helped participate in understanding what might be or working on what might be best practices for referral from a CF care center to a transplant center, and working on ways to share how people engage through social media. I'm going to let my colleague Mary Dwight talk a little bit more about advocacy, but members of Community Voice signed up for advocacy action alerts and helped to participate in focus groups. We've also done storytelling and education, working with CFF.org, writing community blogs. People have done speaking engagements, participated in focus groups, and contributed to many of the other things that help us tell our story. Just one more flip to what some members say, that knowing that their experiences affect the foundation, because everyone's experience is different, is important. And that knowing that their knowledge contributes to others with CF and contributes to the community is important as well. So what's next? We're improving engagement and sharing results more frequently. So I told you, not every person in Community Voice participates in every activity, but everyone in the group gets to hear what the group as a whole is thinking. Several members, I believe, who are here today in this room have helped to create a newsletter to make that circle back so that everyone in the group understands what the group is doing. And if there is anyone in the group who's been on the newsletter writing group, will you please come find me after the meeting? I've only met you virtually. I'd love to meet you face to face. And if you are here, just take a moment and stand up. And we're going to applaud and to people online as well who've been a part of this. So we're increasing opportunities, especially in the area of research, and finding innovative ways to expand and apply these community insights across the foundation. So I want to conclude by showing you how you can find Community Voice and all of these other opportunities. You go to the Get Involved button on cff.org. Your voice deserves to be heard, and you may know others who whose voice could be a help to us and to them as well. And if you click one level down, you'll find the link to Community Voice to register and be a part of this very powerful group that's been helping to bring insights to the CF Foundation and has really deepened the way we work together until it's done. So with that, I'm going to turn it over to my colleague, Mary Dwight.
Thank you, Drucy, and happy St. Patrick's Day, everyone. I don't have quite the green that Bonnie and Molly do, but I did get some green nails. So. Well, I'm delighted to share a little bit about the Foundation's policy and advocacy agenda this morning with you. I want to start with a little bit about what we're working on, what is on the policy agenda this year. Very importantly, as Drucy alluded to, our common thread is powered by the community, and what an amazing example in advocacy of the power of your voice. So I want to spend a little bit of time making sure you all know how to get engaged and involved. And then I want to talk a little bit about Compass, which I hope many of you are familiar with, and share a bit more information about the ways Compass is working with the community to help them. So let's start with the advocacy agenda. I like to think of the Foundation's public policy agenda as an extension of our mission. Our job in the public policy department is to make sure that the mission proceeds unfettered, and our policy agenda always drives from the mission. So this is a little bit about how we think about it. What is our job in policy? All of us as advocates for it. It is to be a tenacious advocate for people with cystic fibrosis, no matter what form that takes. We know that healthcare is changing rapidly. The good news is CF is at the tip of that spear on that change, always driving and leading ahead. That makes my job extremely interesting every day because I don't get to solve old problems and follow along what somebody else has done. We are charting the course in policy, just as the Foundation is charting the course in medicine in so many ways. So tackling what's new, what's on the horizon, what may get in our way, and how do we go faster? And that certainly does contribute in both the research agenda and drug development pipeline. Our job there is to make sure that that has everything it needs. We work really closely, and I know Bill Scatch, who you heard from yesterday, and his amazing team is deeply connected to the National Institutes of Health. They just had a workshop with them a couple of weeks ago. I think another one's on the books in a couple more weeks. I know Bruce Marshall and his team are working with the NIH on issues around liver disease. So our job there is to make sure that is fueled and make sure that that has everything it needs through support of the National Institutes of Health. On the other side of that coin, we don't get through those drug development pipelines and get new therapies into the hands of people with cystic fibrosis without the Food and Drug Administration. The FDA, such an essential partner in our collaboration to get people with cystic fibrosis new drugs. And we do an awful lot of policy there to make sure, again, that as we are at that tip of the spear, that those new ways of tackling disease and finding drugs for tiny patient populations, that we are working collaboratively with them. So that is very much a part of the Foundation's advocacy agenda and places where you all can raise your voice to help support that. I'm not going to spend much more time on that one because we've heard a lot about all that amazing science, but I want to make sure you know that that is part of the policy story. We continue on to say that we need to make sure to promote policies that help ensure people with cystic fibrosis have access to high quality, specialized care so they can live longer and healthier lives. Bruce is going to tell you a little bit more about what that high quality, specialized care looks like. You all live it every day with collaborations with your care centers. But I think that the last 15 months has really shown how policy fits into that piece. We have to be sure that people with cystic fibrosis have access to these amazing new developments and the bedrock of cystic fibrosis care in the care centers. So that's what I want to spend a little time with you today talking about it. How many people have seen this slide before? Yes. This is what drives every decision we make about the Foundation's position around health care insurance policies, access policies, how we engage. It's quite simple, and I hope it makes sense to you. Cystic fibrosis is a complex disease. I don't need to tell anyone online or in this room that. And it involves and must have a whole team of care and a lot of therapies involved. That is our job in the policy arena, all of us, to make sure that that is never unfettered. So that means that health insurance, pretty key to getting that high quality care, is essential. And these are the principles that frame it. Health insurance must be adequate. It has to cover the therapies and care at an accredited care center that uses the latest research, the clinical guidelines, and the best practices. Basically, you know what this means? You're not going to get your CF care at the Minute Clinic, right? And your health insurance is going to cover that. It has to be affordable. That's kind of a no-brainer. We know this is an extremely expensive disease, and we know that it places a lot of financial burden on all of you, and that is something that must be addressed. Health care needs to be affordable. Health insurance plans need to be affordable. They cannot place undue and additional burden on somebody with cystic fibrosis or frankly any pre-existing condition, right? You don't need to pay more. It has to be available. And this one I think sometimes gets a little murky. What do I mean by available? What I mean by available is no matter who you are, where you live, how old you are, how much you make, or if you have a pre-existing condition or not, that you have health insurance that works for you. And so this is what grounds us in our policy decisions and the position that the foundation takes. So what are we watching this year? I think all of you know that health insurance and the way people get it has been the source of a lot of discussion in the last 15 months. And we raised our voices to say we were strongly against efforts to undermine many of the principles I just walked through, undermine protections that are critical to people with cystic fibrosis to make sure they have affordable, adequate, available care. We're still at it, okay? I want to make sure you all know we are still at it. So what does that look like now? There are three things I want to call out that are still very much on the table right now. The first one, and I think of this really at the very top, I think about this all the time, 2 a.m, Medicaid. Who can tell me a reason why Medicaid is important? Shout it out. Adults, people with children, people with CF need it. Medicaid is a vital safety net for this community. Over half of all children with cystic fibrosis and over a third of all adults in our community rely on Medicaid for some form of their insurance, some or all. That is a lot. Over half of all kids, over a third of all adults. This is an essential resource to our community. And what you may not know is how reliant many of our care center hospitals, the places that our care centers are housed, rely on Medicaid. It is a bedrock funder it provides about half of all funding for children's hospitals across the country. Okay? So even if you are not on Medicaid, Medicaid matters to you. And we are very concerned about some of the trends that continue to happen in Medicaid right now and are engaging both at the state and national level. What do I mean by Medicaid trends? Overall, there continues to be a discussion that is about narrowing who is served by the program and what is covered. There are discussions around eligibility restrictions, narrowing the population, placing limits on how long you can be on Medicaid, placing lockout periods if you don't adhere to certain policies and procedures on Medicaid, placing work requirements on Medicaid. You have to work if you want the program and you want the benefits. And you may hear sometimes, well, that's not going to apply to cystic fibrosis. But unfortunately, the bureaucracy doesn't pay attention to that. And we've seen too often in areas where they've tried some of these new restrictions that people who are supposed to stay on the program under the theory of it get kicked off in the swirl of paperwork. A hospitalization made them miss a filing, and all of a sudden, somebody with cystic fibrosis has lost their care. So we believe this is a wrong way to go about fixing a program that, yes, may need some improvements. Absolutely. This is not to say that Medicaid is perfect, but we would much rather be engaged on strengthening the program to make sure that it provides the high-quality care that people with CF need and deserve instead of placing barriers to that care. We're also, no surprise to anyone, drug pricing and spending is a hot topic in healthcare, right? I want to assure you that this is something that the foundation thinks about deeply and evaluates extremely closely on pretty much a daily and sometimes hourly basis. We know that costs matter in healthcare. We know that cystic fibrosis is a costly disease. We know that that cost can place barriers to your care. And our job, again, is with you to be a tenacious advocate for what that care should look like and how we define what good care is, and to be sure that that is what gets covered. So I'm Amy, I need your elephant picture, right? This is very much on the table. And when you think about the policy agenda, I'll be honest with you, there is a lot of talk about drug pricing right now at all levels of government. I will say that we have yet to see a lot of action that would be meaningful. But we're certainly watching it very closely, always willing to engage in the conversation. And I think it'll be interesting to see how things shift out. The Affordable Care Act, the ACA, continues to be on the table, continues to be in the discussion. Right now, a lot was done to it last year, even though we pushed back some really harmful changes in the form of those large pieces of legislation in Congress. It is still on the table, and there's a lot of chaos and uncertainty, particularly in the individual marketplace. That is, if you're not getting your care through a public program like Medicare or Medicaid, and you're not getting your care through your private employer, the individual marketplace would be where you would purchase health insurance. And we know about 10 to 15% of people with cystic fibrosis, that's where they're getting their care. So that's not a small number of our community, right? And leave no one behind. We want to make sure this place is a place that works for you. I think this is an important place, even if it's not something that you yourself are participating in now. It may very well be something that you need in the future. And we want to make sure that this marketplace works for everybody and that we don't segment into two markets, one for healthy people and one for people who actually need care. Because if you follow me on Twitter, one thing I always say is at some point, everybody needs health care. And so it's really important that we continue to drive towards stabilization. And that's something that's actually a very hot topic just right now in the next couple of days. So we'll be watching that, and there'll be some action items for all of you to take in the near future. So we expect 2018 to continue to be a bit of a circus. Unfortunately, we're watching on a lot of fronts. One thing I will say is that the issues remain the same and the policy principles remain the same: affordable, available, and adequate. Sometimes they're just going to take different shapes, and the debate will take place in a different format. To me, that's the purpose of this slide. Lots of things are swirling. It's happening at the federal level. It's happening in the administration, in Congress, and also at the state. It all rolls up into those same policy principles, and we all still need to stay engaged. So let's shift over to talk about how you can be engaged. And I want to start with sharing a story of why your voice matters, if we can roll the video.
It is now my great pleasure to present the Breath of Life Legislator Award to our U.S. State's Senator, Susan Collins. Hi, my name's Stacy Morrison. I'm from Gardner, Maine. I'm the proud mom of a 12-year-old son with CF named Zachary. The 4th of July in Eastport was always a special time for me as a child, and the past few years I brought my child there. Senator Collins was at the parade that day, and I saw her as well as my mom, and my mom's like, "I need to speak to you."
And all of a sudden, I see Diane Morrison, who I've known for many years, making a beeline for me. Well, she reminded me that I had met her grandson, Zach, when he was an infant. But she was worried that the health care bills that we were considering in the Senate would mean that insurance might be too expensive or even denied to him someday.
I worry about Zachary when he's an adult and is no longer on my insurance, and I want him to have access to full health insurance.
The conversation strengthened my resolve to ensure that any health care legislation had to protect people with pre-existing conditions. It's so important to hear directly from constituents. Then the issue becomes real. It's one thing to talk about pre-existing conditions in a theoretical way. It's quite another to have sitting across from you a 10-year-old child with CF.
Advocacy can feel overwhelming at times, but if you are passionate about what you are trying to accomplish, you just need to speak up.
And thanks to Stacy's diligence and knowledge, I was delighted to learn that Zach was enjoying a very active life without the protections that the Affordable Care Act provides for pre-existing conditions, including cystic fibrosis. That progress, that promise of a bright future for Zach would be in doubt.
Don't let anyone tell you your voice doesn't matter, right? And one conversation can't change the course of an entire country's discussion, right? That was one of 3 Republicans and 48 Democrats to say no to undermining those critical protections. And as my colleague Dave Elan likes to say, cystic fibrosis was the magical unicorn that flew down into the rainbow to save healthcare. So I know so many of you listening online and in this room probably already are advocates. Let's see if we can show a little bit of that. If you joined us on Thursday, which was like 36 hours ago, if you are one of the 220 people who joined us on Capitol Hill on Thursday, can you please stand up? If you have ever joined a Cystic Fibrosis Foundation Advocacy Day, please stand up. Stay standing, stay standing. If you have taken action to email your members of Congress or your state elected officials, please stand up, stay standing. And if you are going to be one of those people, then stand up. I'm channeling my inner Mike Beatty. Thank you. Your voice matters so much. As Preston has said repeatedly, we punch above our weight, and it's because of you. Your voice is amazing. The cystic fibrosis story, Amy, powered through so much of the debate last year, and it continues to be meaningful. I can't tell you the number of conversations that we've had as the policy team just in the last couple of weeks with offices who are making decisions about the things I just went through, who said, I hadn't thought about it that way. That's what we want. We want to make them think a little bit differently about your story. And so we need you so much. So there are a few ways to take action. Please take out your phone right now. I want you on your phone. And text FIGHT CF to 52886 to make sure you are in this fight with us, you are engaged with us, and you're hearing from us about when we need you. We need you to register for action alerts and advocacy alerts if you haven't. I'm not seeing a lot of phones. Out. All right, if you've already signed up, great. The other things people say, what else can I do, right? This was Mark's question to you that he says he's hearing all the time. What else can I do? Recruit others. This advocacy looks very much like everything else we do in CF. It's about telling our story and asking them to join us. When you send those action alerts, post it on your social media. Send an email to your friends and family. The same folks that you may be talking to about Great Strides or Identidance, ask them and say, I need your voice now. Please recruit others to take action. You all know so many people, and the voice reaches so far. Take action. I think Jeremy Olam yesterday in our advocacy breakout said, please read the advocacy emails. Please do. They're really informative, and hopefully we've kept them pretty brief. It helps you keep engaged about knowing what issues are on the hot burner right now and where we need you to take action. The Cystic Fibrosis Foundation's website for advocacy is a rich resource. Maybe I'm not the only person to read our regulatory comments page. It's very exciting. And then, as I said, share action and take action with your friends and family. So thank you. Thank you for being an amazing, inspiring voice for people with cystic fibrosis and, frankly, so many others. So now I'm going to shift gears a little bit quickly, and I get to brag about the amazing Compass program. I hope all of you are familiar with it. It's really a remarkable service, and I'm super proud to be able to work with all the folks who are on the front lines of helping the community navigate through all the complexities that CF throws at you all. And I just want to share a little bit about what that looks like quickly. So I know, Bonnie, you stole my thunder yesterday a little bit, but thank you. I'm glad to have it. Always brag about Compass. Compass has received, last year in 2017, over 12,000 calls from the community. These numbers continue to tick up, and we love that. We want more and more people to reach out to Compass because we really do want to be there as a resource to help you. We get calls from people with cystic fibrosis, family members. We work a lot very closely with care centers. We love it. But we also know that a lot of people who could benefit from Compass don't always know about it and aren't always the ones who are using it. So we hope you help us share the stories and the way we can help. Over 5,000 individual cases. Specific issues that we help with are navigating insurance, finding it. If you're comparing plans in open enrollment or you're switching jobs and you're not sure what this new plan looks like for you, we can help you walk through it and compare. Is your care center in network? Are all your drugs in network? How might this be covered? What's the financial picture going to look like? Those are things Compass can help with. We also can help with finding financial resources to help shoulder some of that care. And we help with a lot of other individual non-insurance questions, legal issues. If you have a question that you need help with on navigating school issue, getting your kid the right care at school, we have legal resources through Safian and Passamano that can help you with that. Helping ask questions about disability applications, enrollment, things like that, we are more than happy to help with. And some of my favorite stories are the other bucket. We need a better name for that, but it really is kind of other bucket. Find me later and I'll tell you a story about skunks. We helped 27 people, actually. I'm sorry, the slide is wrong. During the hurricanes, and Bonnie shared such a beautiful story about that, of getting people what they needed at the last minute when really chaos was reigning, and we're thrilled to do that. Our team is doubling. Our team grows as you need us, right? That's our job, to make sure that we're always giving you what you need. And I just want to close with a few things of some of the folks that are helping you in the front lines. We want to be there. We want to help you. There are some amazing stories that have come out, and we need your feedback, and we need you to tell us what we still can do to help you. Our case managers are amazing. They're super friendly. They're super resourceful. Here are some of them. And this is some of the other bucket, right? Finding a scholarship. Making study abroad possible, answering questions around financial issues and new dreams beyond health. So if there is an answer, we will find it. They're amazing folks, and I'm so proud that they're part of our team. Thank you so much, and it's now my privilege to introduce Dr. Bruce Marshall.
Nice job. Good morning. Amazing, powerful women. It's an honor and privilege to share the podium with them. And Bonnie, I have a tendency to ramble on sometimes. If I go too long, feel free to come up with the cane and pull me off the stage. So I entitled this presentation, High Quality Specialized Care, Together is the Way Forward. And you've heard that word together many times at this conference. In fact, it's on the podium that you're looking at. So this morning, I hope to convince you that together also applies to high-quality specialized care. But first, a quick look back at how far we've come. This photo from about 50 years ago shows a family with CF advocating for their child. The poster says, "Help. Cystic fibrosis, a major killer of our children." The progress from then till now is just simply amazing. And I could show it in a variety of ways, but I'm just going to show this one slide. When I started in CF care and research in the late 80s, there were about 5,000 adults with CF. Now there are over 15,000. Adults like Melissa and Danny and Cherise that we heard from yesterday, they've achieved educational, career, and life milestones that weren't imagined when I started in CF care. But we also heard how difficult it was. So we still have much more work to do. These are some of the key drivers of our success. The passion and power of the community to literally change the course of history. Multidisciplinary care teams that provide coordinated care and bringing all the right expertise to the table. We heard yesterday about the exciting work in the development of therapeutics and the hope and promise ahead. Continuous improvement that goes back to the roots of the organization and the care center network and the spirit of collaboration. I'm going to drill down in an area that I'm particularly interested in, continuous improvement. Shortly after I arrived at the foundation, we pulled together CF experts, quality improvement experts, and we developed a roadmap for quality improvement, and we entitled it an opportunity statement. There was an assertion, a vision, key strategies, and worthy goals. And I won't bore you with the details, but I am going to review the worthy goals because I think they still stand today, and then I'm going to hone in on one of those worthy goals. The seventh related to access, and you've just heard from Mary about that. The sixth was about advanced lung disease and lung transplantation. You heard about that yesterday from Dr. Farrow. The fifth was patients will be screened and managed aggressively for complications of CF. We want proactive CF care. The fourth was clinicians and patients will be well-informed partners in reducing acquisition of respiratory pathogens like B. cepacia, NTM, and others. The third was all patients will receive appropriate therapies for maintaining lung function. Pulmonary exacerbations will be detected early and treated aggressively with a goal of achieving previous baseline lung function. Children and adolescents will have normal growth in nutrition, and adults' nutrition will be maintained as near normal as possible. And we've made tremendous strides, literally, in all of these goals. But I want to focus on this goal, worthy goal number 1, and I'll let you read it. It's about patients and families as full partners. This goal is really about unleashing the power or unleashing the fury. At the Capitals games, right towards the end, they play this song and say, "Unleash the fury." Patient engagement has been called the blockbuster drug of the 21st century. This is all about tapping in to what you all know, your lived experience with CF. Your knowledge, your wisdom, your lived experience, and bringing that to the table. This worthy goal was drawn directly from Crossing the Quality Chasm. Came out from the Institute of Medicine in 2001. And I'll be honest, I didn't really pay much attention to this worthy goal. I went charging after FEV1 and exacerbations and BMI. But as I've developed some more gray hair and come under the influence of Cindy George and Kathy Sabadosa and others, I've come to realize the wisdom in this worthy goal. And in fact, I think it really belongs in that number one slot. And I'll try to illustrate that with a few examples this morning. There's a framework recently published in Health Affairs that talks about the continuum of engagement from consultation to involvement to true partnership. And they talk about it at a couple different levels. One is in the direct delivery of clinical care. The consultation stage, this is patients receive information about a diagnosis. Involvement is patients are asked about their preferences in the treatment plan. And then partnership is about treatment decisions made based on the patient's preferences, as well as medical evidence and clinical judgment. The first example I'm going to talk about is partnerships for sustaining daily care. This came out of our last strategic planning effort at the foundation, and it came out as sort of, you might say, a top-down initiative with the words compliance and adherence. And Cindy recognized early on that patients with CF and families with CF, they don't need finger wagging. They don't need judgment. They need partnerships. And she's entirely reframed the initiative around partnerships. People with CF and families with CF working with the care team as equal partners to sustain daily care that's 24/7, 365 days a year, collaborating on a plan that can actually be carried out. That daily care, balancing time for the treatments, plus living the life you want to live. Cindy has reached out to the community, the clinical community and the patient community, to develop champions, and she's collected stories on the power of partnering. Some of these resources are on our website. I won't read each of these, but I'll read Melanie's comments there in the lower right corner. As a CF patient, it's my job to be open and honest with my CF care team. And then hear from Tammy, a social worker. She says, it's my job to listen and honor each patient's CF story, meet them where they're at, and empower them to be their own best advocate in their care. Another example is this co-production dashboard. Co-production, another term for partnerships. This dashboard was designed by people with CF and clinicians, and this was a pilot to test how it would work in the clinical setting. I love this particular photo. You can see this young lady, I think about 10 years of age. She's got her Fitbit on her left wrist, and she's deep into studying her PFT trend over time. A little scientist in the making, I think. This dashboard includes the medical data, like the FEV1 trend that she's looking at, but also patient-reported outcome data on mental health, quality of life, and also the goals for the upcoming clinic visit. Well, I must say the technology platform that we selected to test this dashboard has fallen short of what we had expected, and I don't think we're going to stay with this particular platform. But that said, we've learned a lot. And there are 3 key lessons. We just had a debriefing session at the foundation about 2 weeks ago. Seeing the data is empowering for patients and families. Setting the agenda for the clinic visit is really important. And team preparation for the visit is key. And I'll share just a few quotes from this debriefing session. I've already mentioned that first quote, patients having the registry data was empowering. It leveled the playing field. In terms of setting the agenda, a few quotes. These are from physicians. Knowing their most important thing to discuss at the visit is the absolute key. Another physician said from the dashboard work, starting with their agenda, not my agenda. And one that I particularly like from another physician, it's what doctoring should be, better listening and then applying the data. And then the final lesson that we've drawn from our experience thus far is the team preparation is really key. One of the docs said, having all the data in one place facilitates the visit. It's all about efficiency. And a parent said, clinicians seem to be more aware of what was going on in our lives. So back to this framework, and I realize you can't read this from the back of the room. I've initially focused on two examples in the delivery of CF care. This next level is at what you might say is the center level or the organizational level. And at the consultation phase, it's the organization surveys patients about their care experience. At the involvement stage, hospital involves patients as advisors or advisory council members. And at the partnership stage, it's patients co-lead hospital safety and quality improvement committees. So you see the emphasis is we want to push to the right. We want to tap in to that well of experience and passion. So an example at that center level or organization level is this CF Pilot Learning Network. We're approaching the end of our third year in this work, and I think we've hit a tipping point. I think it's going to be a real value add. The aim of the network is to establish an infrastructure for collaborative learning and demonstrated progress in improving outcomes. These are some of the outcomes we're focused on. Notice the order. It's the patient outcomes that are at the top. BMI and FEV1, my passion, they fell down to the bottom. I think this order is right. Just some statistics about the network. 29 programs in 15 states, a mix of adult and CF programs covering nearly 5,000 patients across the country, and a group of community innovators that includes 59 patient and family partners. The current focus areas for the network are shown here: timely registry data entry, pre-visit planning, one of the cores from the chronic care model that Ed Wagner and colleagues developed, population management, and co-production of care, or partnerships. I'm going to talk just about two: timely data entry and co-production. As part of this work, we've developed monthly reports that we feed back to the care centers participating in the network, as well as for the network as a whole. This is about timeliness of data entry, and the lower the number, the better. This is a metric that measures the time between when the clinic visit occurred and when the data is entered into the registry. And those bumps that you see, that's the deadline for the data entry. For example, for 2017, we closed that around March 1st, and the centers are furiously entering their data, and you can see it results in delays. But look at this cohort from the learning network, that last year, that bump didn't occur. And the timing between the clinic visit and the data entry is approaching zero. Why is that important? That's on this next slide. Because if we get the data into the registry, into Port CF, we've put in place processes to download the data nightly, to process it, and get it out by way of reports to the care centers. So we can help in their quality improvement activities and with decision making on clinical care. So the 24-hour turnaround. Here's one example of a patient summary report. It shows all the facts, and I realize you can't read this from the back of the room, but perhaps you can see the graphical trends at the top in pulmonary function measures and at the bottom in nutritional measures. And those shaded areas show hospitalizations and home IVs. And oh, by the way, Mark, this is made up data. We don't have to worry about privacy. But what you see is that increase was related to a transplant. And you see that increase in pulmonary function. We feed this data back. The centers use it for pre-visit planning. Many of them share it in the clinic. And again, this data is empowering. So I talked about timely data entry, and the other thing I wanted to talk about is co-production. And I want to talk about this through the story of the Portland, Oregon team at Dornbecker. And I want to focus on a parent of a child with CF, Lindsay. Lindsay joined the care team in 2013. She had been on the Family Advisory Council. She was asked to join their team when they participated in a Learning and Leadership Collaborative in 2013. She attended weekly QI meetings, provided the patient perspective, but she didn't travel to the face-to-face meetings and really did not get fully integrated. But over time, their relationship grew, and she was invited to attend all the CF meetings at the center, held every 4 to 6 weeks. It took a while for the whole team to grow comfortable with her being in the room, but it really provided a patient and parent voice to all the center's activities, QI, clinical, and research. We can even get this, Lindsay's journey, on a graph. I love it. So this is the first bullet point. She joins the QI team. The Portland team joined the Learning Network in 2016, and this really opened their eyes to getting patients and parents much more involved. And Lindsay stepped up as a leader of their QI meetings. She led their efforts to bring the work back to the Family Council and brought their feedback into the work of the team. It's been an amazing journey for this center and for Lindsay. And just in the last few months, we invited her to join the network leadership team, and she's already contributing there. So an incredible co-production story. And on this scale, this particular center is operating at the level of 6, with the maximum being 7. And I won't go into the details of that slide, of that scale, but I think it's an important scale and one that we should measure. So I asked the center director, Mike Powers, to sort of reflect on what he and his colleagues have taken away from this journey. And this is what Mike talked about. He talked about co-production as an important part of CF care at their center, that it levels the playing field. It facilitates a team approach to chronic disease management. That effective co-production takes dedicated family members and a team that provides an inclusive and welcoming environment. And that it's important to keep the needle moving forward, ensuring patient partners lead meetings and participate in all roles, and using technology to bring in people with CF. So if you'd like to learn more about this learning network, I'd encourage you to check out this website. And this is the landing page. Improvement starts with you. So back to this framework that I talked about earlier. I've shown a couple examples of engagement and pushing to the right in terms of direct clinical care, and one example at the center level or organizational level. Down here at the bottom is an important part of this model, that there are factors that influence engagement. or what you might call barriers to achieving true partnership. The partnership that we're looking for between people and families with CF and their care teams. When it works, as we heard from Melissa yesterday, it's magic. But we know it doesn't work well all the time. In fact, I've heard frustrations from John and Michelle and Bonnie at this very meeting. And we need to address those concerns. The potential barriers on the care team side are also very real. Perhaps there's an old school physician who has the mindset, just do what you're told. Or maybe the physician and the team are stretched for resources and they really don't have the time to invest. On the patient and family side, there are also barriers. Health literacy, and I know this doesn't apply to many or all of you in this room, but there are patients and families that have challenges with health literacy, with socioeconomic status. It's hard to advocate for your health if you're worried about your next meal. And this next slide is another potential barrier, mental health. We've heard about this as another important aspect of CF care. And I'm pleased to report that we're seeing some positive early signals in the registry data and in the experience of care survey data that our investments are starting to pay off in this area. This, by the way, may also be a significant barrier on the care team side of things. We hear about physician burnout, nurse burnout, so we have to pay attention to the healthcare team and their mental health as well. They work in a very demanding and stressful environment. So in conclusion, I hope I've convinced you that together is the way forward for high quality specialized care as well. And we're not naive. We recognize there are barriers, but if we pull our collective passion, knowledge, and wisdom and experience, I think the sky is the limit. It's all of us together, patients and families with CF, care providers, researchers, and the CF Foundation. Thank you for your attention, and I have one final slide, and I disclose this is a shameless advertisement. There is a medical hot topics breakout, more about CF care in the ambassador room this afternoon. So thank you for your attention.
All right, Bruce.
All right. So I get to drive the questions, and I may have threatened them earlier in the week about my having the question handle. Thanks, guys. I always love hearing a little bit more depth about what you guys are working on, and this is a great panel because we do work so closely together all the time. All right, Drucy, there are two questions that are somewhat related here that I know people are curious about a lot, which is basically the peer connect, the mentoring collaborations, dropping down into younger ages. So here's one asking about my 6-year-old, would love to meet other CF kids so he could FaceTime and play Minecraft while he does his treatments. And here's another one about expanding to teens. So I know this is something on your mind, and if you can tackle that one for us.
Sure. Whoever in the room had the idea about Minecraft, I'm serious, that speaks to that age group. Mentoring, talking about going through transitions, that's not what a young child wants. But we are looking for innovative ideas from the community. What day is it? Today is St. Patrick's Day. In another week, the impact grant application process will open. That is exactly the type of thing we would like to hear from the community. If you have an idea like that, please, again, go on to cff.org. Same thing. Get involved. Go to the next level. You'll see that impact grant application page. I think it opens on March 31st. But that is exactly the kind of idea we're looking for. What speaks to young children? Could be young children with CF. It could be siblings. It could be something else. If you have an idea, please apply for an impact grant. We want those ideas. Speaking to teens, this is an issue actually across the foundation this year, is understanding how teens want to connect with each other. So in my sphere, it's not about how am I going to get that teenager to do their stuff, right? Because that doesn't work, as you just heard from Bruce. We do believe that building a sense of community is important. You heard yesterday in the panel about how there was a time where there were these natural support systems, and we are looking for ideas. So again, March 31st, the impact grant application process opens for you from the community. If you have ideas, please give them. From our side, we are really spending 2018 trying to understand the best way that we can build community among teens. It may not be what we have right now. It may not be mentoring. We actually lowered that mentoring age to 16 and haven't seen a lot of uptake in that area. If you do know somebody who's 16 or 17 thinking about transitioning to an adult program who might benefit from a mentor, that is available.
All right, Bruce, there was some interest in co-production and all the conversation you just shared with us. Can you say a little bit more about the expansion plans for this? So I think you guys are in a pilot phase now. How are you working to share the co-production model with all care centers so all patients can have this experience?
It's a great experience. I mean, it's a great question. And our experience is that we want to do it in a staged fashion, and we're trying to bring some of the streams of work together. The work we do with Dartmouth, Cindy's work, and what's going on in the Pilot Learning Network. So we've started meetings to try to map out the future, basically, and how are we going to expand and make sure that when we do expand, we have the resources in place and the personnel in place that we can continue the momentum. So the details of that are not yet worked out, but we do plan to extend from the pilot into a full-fledged learning network, and we'll be looking to expand within the next year or so.
And a similar question is, how can we find out if our clinic is involved in the collaborations now?
I believe on the you can email Mary or email me. I think on the website, I think that I mentioned there, CF Learning Network has a participating sites. If it's not there, you can email one of us and we'll let you know.
Great. Here's one for me. Medicare is critical to adults as well. When advocating for Medicaid, is Medicare also discussed? Absolutely. I would say that we know Medicare is very important for it's about 10 to 12% of our adult population gets their care through Medicare. And fun fact, most of those folks are now coming in through disability, which you heard about yesterday on the panel. But we are seeing a few folks who are coming into Medicare because they are 65, which is pretty cool. So we are very aware that Medicare also poses challenges and barriers. Folks having to wait 2 years, up to 2 years to get into Medicare. We know that's a barrier. We know there are some unique financial challenges in Medicare. And we are absolutely, that is on our advocacy agenda and policy agenda. And we're also working very closely with Compass. There'll be a very deep dive Medicare 101 for care teams at the North American this year, because they too have questions about how to navigate this very complex and different care entity. So it very much is on our agenda. All right. Here is one about Bruce. How can we get access to the CF registry data for our child? I know there are some things on the website, but the dashboard sheet you showed has more information. Can you tell us about that?
It's a good question. That we thought that co-production dashboard was going to solve that issue because we do want to display back the registry data. But as mentioned, the technology platform is not what we had hoped it would be. So we're going to have to go back and reinvent the wheel. So at this point, the only data that's there in the public domain is the annual reports, which has detailed information at the national level. Each center gets a report, and if you have a patient family advisory council, you should be seeing that data. But at this point, the patient level data would have to come through your care team. But we're actively considering alternatives to the technology provider of that platform to get that data directly into your hands. I don't have a direct answer for you, but that's definitely top on our high on our priority list.
But Bruce, for an individual, the care center does have access to an individual's data, and as you said, if you want data about your own yourself or your child, the care center can help you with that.
Yeah, that's smart. That patient summary report that I showed, that's one where that's just been deployed within the last year. So we're still seeing adoption across the care center network. But the centers are using those, and many of them are giving them out in the clinic. So that's something you could and should request.
Here's one for me. If I want to get involved in March on the Hill or a state advocacy day, what do I do? Love that question. Thank you for asking it. The best way is to talk to your chapter. We work extremely closely with chapters across the country to get folks engaged in advocacy, especially those days where we're up on the Hill and it's beyond emailing. So please talk to them. I will brag, and this is like a geeky policy brag. One thing that we do in our outreach, especially to Capitol Hill, is think about our targeted congressional offices, and we really want to get into the offices that oversee healthcare and are the ones writing the healthcare bills, voting on them in committees. So we have a target list of members of Congress who really are arms deep in healthcare agenda, and we really want them to know the cystic fibrosis story deeply. A goal of ours this year for March on the Hill was to have a constituent, somebody who votes for that member, not just from that state, but a voting member of that particular congressional district in every one of our targeted members. And thanks to an amazing collaboration with all of you and our phenomenal chapter staff, we accomplished that goal, and we had somebody who's voting for that member of Congress in every one of those targeted districts. So we do need you. Please help get involved. Okay, Drusy, you get to brag a little bit, and I know because I know this just happened, and there's some more plans for this. Is there a Peer Connect mentoring program for spouses of CF patients? But maybe what a cool question, right? That we're talking about programming for CF spouses because we have a lot of them. Can you talk a little bit about some of that programming?
Absolutely, and it is a wonderful problem that there are so many spouses out there, and they do have unique challenges and a unique view, and so that is one of the target groups for this expansion of peer mentoring, which will happen within the next couple of months. I will say also that spouses can attend the family events, FamilyCon, for example, or the transplant mini-con. Spouses certainly are part of that journey as well. And then last, I do want to say these ideas that come from the community through impact grants are so important. So one of our original impact grants was for something called CF Spouse, and it is a support group for CF spouses. It has about 250 members in it, and in fact, we are connecting with that group as we expand peer mentoring. So if you've got those ideas, especially that Minecraft one, that really speaks to me. March 31st.
Awesome. Bruce, what are the trends in making CF care centers more uniform in protocols, and are centers more receptive to sharing successful protocols? So this is Bruce's baby, quality improvement.
Yeah, it's a good question, and we do promote sharing. I didn't mention this in the Learning Network. There is a technology platform called the CF Exchange. We encourage teams to share what they're working on, their successes and failures even, so people can learn, why repeat the same mistake over and over and over again. And that's been a big part of the Quality Improvement Initiative for many years, sharing ideas across care centers. In these learning and leadership collaboratives, we bring teams together. They share ideas. We typically take them to a high-performing site, and they get to see a high-performing site doing what they do back home. And invariably, what they come away with is, first of all, an explosion of ideas that they can bring back, but that it's not exactly rocket science. It's basically about leadership and teamwork and communication, just the basics of blocking and tackling to get great care delivered. So we're all about sharing ideas across the network. We also, with our registry, Port CF, we've got a resource section, and there's a lot posted on there that teams can seek out ideas. And now what we're trying to do, and again, this is something that we've picked up from the Learning Network, is to try to organize in certain areas. I mentioned pre-visit planning and the importance of pre-visit planning. We're starting to organize all the work into what's called a change package. And it basically kind of boils it down to, what are the 2 or 3 key ideas in there, and how do you track it? And kind of distribute that through the Learning Network. And then what we're looking to do with the Learning Network is to sort of make it a fishbowl. So what's developed there in terms of reports and resources, we make it available to the entire community. And eventually we'll expand the network. But did I hit that question okay?
So we don't have any more online, so I will pick one, which hopefully is a fun one to answer for each of us. Drusi, what are you most excited about that you're hearing from the community and that you guys are working on to implement?
Well, first of all, everything I talked about with Community Voice happened between last year at VLC and now. I think what I'm most excited about is this incredible energy and the flow of ideas and the interchange. It is amazing, and it is unleashing the power. That to me is remarkable. It's exciting. I really can't wait to see what this next year brings, and it makes my job so easy. I don't have to come up with any ideas. It's just, what are you looking for? Let's figure out if we can make it happen.
She's being a little modest, but Bruce?
Yeah, I'll mention 2 things. I talked about one today. I'm really excited about this partnership concept. I think if we can unleash what's sitting here in this room, it's going to be amazing. But then, back to my nerdish side, I'm also really excited about the data and this capability that we have now to get the data and get it back to the care centers as information to help support their improvement activities, to help them make good decisions about care. I think that's really, really exciting. And when you pair that too, and I think that's what's special about the CF care model is the sort of the human side, the caring, the relationships, the partnerships, kind of paired with the science and the data. When you put those 2 together, it's a combination that's hard to beat.
And I'll pile on.
I'll ask you.
I agree. That's what I'm most excited about. I still stand in awe of watching this community come together last year, what a force it was, and it was amazing to watch the connections being made throughout the community, really led by Melissa and Rebecca, but the online force and the conversations spreading out. And to me, that's what I'm excited about in our space of policy and advocacy, because I think it really is that powered by the community. And what we see is when we can layer that with the data that Bruce just talked about in conversations with decision makers around CF care and coverage, when we get in there and they hear the story that these decision makers like payers and Medicaid agencies and politicians, they're so amazed. They really do get that this is the best story in medicine, that this is what everybody is talking about, where we want to go as a country. And so I love being able to layer those stories and our amazing data stories to say, help us keep moving this forward. So I think that's it. Thank you so much. It was great.
Thank you all.
Thank
My
you.
colleagues.